Hi, everybody. Thank you so much for coming to our webinar series. Today, we're just so honored to have Dr. Angie Crawford. And Dr. Crawford, she graduated from the school psychology program at the Graduate School of Applied and Professional Psychology at Rutgers University. She is a certified school psychologist in both the state of Pennsylvania and New Jersey. Angie is also a veteran of the Haven program, and she was among the very first practicum students to start the Haven, where she is currently working as a staff psychologist. Angie is also a school psychologist for the Pennsylvania School District, and she's working with students in a kindergarten to eighth grade program. She is very experienced in working in schools and a hospital setting with children and adolescents, completing assessments and providing therapy. Dr. Crawford is currently raising 2 teenagers of her own, and she is an advocate for helping parents and teens develop healthy relationships. Let's welcome Dr. Angie Crawford.
Thank you, Dr. Hui, for that wonderful introduction. I'm so happy to be here today to be involved with this Haven parenting series. As Dr. Hui identified, I'm a parent of teenage children myself. And so I've come up with the new saying when it comes to thinking about this teenage phase. Terrible twos has nothing on the teenage years. That's something that I learned over the last few years with dealing with teenagers in my home. This is a very challenging time for children, for teenagers, as they're coming into young adulthood. They're finding themselves, they're finding their independence. They are just navigating the social network realm, experiencing things that we couldn't even have imagined in our adolescence. And it's also a challenging time for parents because like I said, we already know there's no manual to this parenting thing. And dealing with teenagers, their attitudes, their changes, the pressures that they experience, and being tasked with the job of remaining calm, yet supportive, and helping them to navigate this stage is quite the parenting task. So I'm really excited to walk through this, do this talk with you all, and present a few simple strategies for helping your child to navigate the teenage years. So a problem well defined is halfway solved. So we know what we're dealing with. If we know what this human being who we are supporting is dealing with, you understand what they're experiencing, and you can help them figure out solutions and even help yourself regulate and understand some of this is normal, what is a red flag, but to kind of ground yourself. So in terms of development, understanding what is normal development is very important. And in the teenage years, as you all know, who are parents of teenagers or teachers or have experience with dealing with teenage individuals, you know that the physical changes drastically throughout these years. And it actually starts earlier than the teenage years. Children go through the prepubescent stage. And that starts around 9 to 10 for girls, where you'll start to see breast development and changes in their height and in their weight. And then they go into their menstrual cycle. And from there, they start to develop hair and all kinds of bodily changes. And I've dealt and talked with many of clients and also experienced myself how the girls' menstrual cycle can change their appetite, it can change their mood. It can even cause physical pain for a lot of young girls who are going through that experience. So something to be mindful of, that changes happen drastically to the adolescent's body. And in boys, the development starts a little later. You'll see growth in height, you'll see growth in body mass, clearly changes to their genital areas, hair development on boys as well, voice changes in boys. their growth spurt actually occurs later than that of girls around 11 to 16, and boys between the ages more of 13 to 18. So we've always, maybe we've heard the term or the saying, girls develop faster than boys, and there is a lot of truth to that. So your children, our children, go through physical changes, drastic changes that absolutely affect who they are. In addition to that are the psychological changes that a child goes through at that phase, in the adolescent phase. They start to become more abstract thinkers. They start to think about and establish satisfying relationships outside of the family. And that could be within friendships and romantically. They start to develop a maturity about themselves, a sense of independence, and a sense of self-concept that may not have existed before. They even start to question things, question values within the family, question systems, institutions. A lot of young people now are joining movements and they're protesting, and they are the voice for a lot of change within our society today. So children, the maturity level really increases with adolescence at this phase. You may also see behavioral changes in your child, your teenage child. In this phase of life, there is a separation between the parent and the child, or the parent and the adolescent. They start to lean more towards their peer groups. In this phase, it's absolutely normal for the child to care more about what their peers think than they do of their parent, who they may have the closest bond with. That there may be an adult in their life who they admire as look to as a role model. But in this phase, what the peers think is the most important thing. You may start to see a child, we look at high schools and we think about cliques. We think about how, sports kids hang with sports kids, or the theater children hang with the theater children. Children start to make those connections with other teens that match their aura. They might start to dress alike, they might start to talk alike, join into the same activities. Those kinds of things start to happen. We have to be mindful of the it mindset, or the it can happen to me mindset when it comes to adolescence, because nobody thinks that thing, whatever it is going to happen to them. It may be teenage pregnancy, that it may be driving under the influence, that it may be something very drastic happening that that may be challenging for them to come back from. And I don't like to say that you can't come back from it, because you can come back from anything. There's second chances and ways to rebuild yourself after any event. But that thing, a lot of teens don't think it's going to happen to them until it does. And as the saying goes, you don't think it stinks until you step in it sometimes. At this phase, teens want that independence. They're growing drastically, and oftentimes we look at our teen, and overnight, maybe it seems like overnight. If you look at pictures, the development seems a little slower, but overnight they may have transitioned into almost like a young woman or a man, and their physical physique and the way they carry themselves and the independence that they strive for is far more advanced than the actual cognitive development, the brain development, the decision-making skills. They are slower than the drastic change in the body and in the drive for independence. They're driving and they're hanging out with friends, and they're going to dances, and they're doing all these social events, and they have this independence away from parents, but the decision making is not caught up with the physical stature. Things to look for that are not normal development, just to name a few, especially things that I've come across in my practice with working with teens. Changes in appetite, and that can be in suppressing appetite or in overindulging. excessive sleeping, excessive worrying, anything really in excess is something to just keep your eye on. Isolation from peers, as we know that this is the phase where teenagers thrive to be with other teens. For a teen to not want to have that connection, especially if it was something that they were developing towards, and then to not want it is a red flag. No interest in things, not being able to find something that they connect to, whether it's music or sports or some sort of cause, or even getting a job with no interest in activity. That's a thing that you want to look out for. Poor performance in school, whether that is a gradual poor issue with making progress, or the teenager is doing fine and then there's a change in their performance, or work, or in the sports activity. These are all things to definitely just be mindful of, that there may be something else going on with them that is having an impact on them. It could be something internal, or it could be stress from an external source. So what are some of the common concerns that parents have? Parents are worrying. I think maybe one of the number one stressors, things that we worry about in regards to our teens is the access to social media, the access to information on the internet. What are they looking at? What are they being exposed to? There's so many challenges right now. And teenagers in this phase are risk takers. They are more likely to do things. And risk taking can be a good, or it can be a negative or a positive thing. Risk taking things that are negative, driving fast, or being dared to do something by their peers, trying drugs, those kinds of things. But on the flip side, being willing to step out on a stage. I have a daughter who's a singer, and she's taking music lessons, and she is going to do her first recital with a solo performance. And I know she's very nervous about that, but I admire her because I could only sing in the shower. I couldn't push myself to, that's not a thing that I might be risky enough to try to do, but those are things that, take guts and grit. You have to be willing to try that in order to make it happen. But the social media now, with all of the challenges and the trends, I'm hearing, I was listening to the radio the other day, and I heard about a trend where there's a young person that goes into people's houses, and they don't know the person, they just go sit in the house. And obviously that's very risky. A lot of harm could come to that person for doing that. And he said he's doing it to get likes. And likes are so meaningful to children now, and teens, that they'll do things that are very risky and very dangerous in order to get them. Academic pressures. Of course, we want our teen to do well, but when that academic pressure is becoming unhealthy, causing them to not eat or not sleep, or to drive themselves beyond their point of where it's a healthy balance, then it is a concern. Video game addiction, phone addiction. We worry about our teens and their mental health, and what is abnormal stress, and what is within the realm of what is healthy stress and healthy anxiety. And of course, engaging in risky behaviors such as use of drugs or alcohol, or engaging in sexual activities that are very risky. And from the perspective of the teen, criticism from parents and teachers. I cringe every time I get an email from a teacher, because I know that teacher has said something to my child, and now I have to follow up. We're both under pressure because my teen has to perform, I have to follow up, and they have to hear bickering from both ends. But this pressure to perform, just feeling like anytime someone says something to you, you're being criticized. Of course, most of the time coming from a good place. Someone wants to see you doing better, someone that cares about you, but seems critical to the teen nonetheless. Managing those expectations and issues with body image. We know that this is the phase of a lot of physical change, drastic change, and teens struggle with managing those changes so quickly. I think in my day, the concern was the models in the magazine, and girls wanted to be too thin, or even boys looking at magazines and wanted to be too in shape, or try to attain these fitness goals that were impossible. And my concern now is all of the, and no disrespect to anyone who chooses this, because people have the right to choose whatever they want for their lives. But the excessive amount of surgery that is exposed to children, the BBLs and the snatch waists and all of that. And this, people are going under to get medical treatment to have their bodies look a certain way. And I am very concerned about what that would do to, and I have teenage daughters, how their lifespan might look, or what they might try to do in order to look a certain way or fit the mold of what the trend is in society. So what can we do? Very simple strategies. Number one, expectations have to be very clear. This might sound like a thing that you do in childhood and early childhood with your children, if you work in education or if you have small kids or kids, expectations are very key. Being very clear. Assume nothing. That's my rule. As I've parented, I'm at my teenage phase in parenting, I assume nothing. If you give your child a task like clean their room, that's an expectation. Your room should be clean. That could mean so many things for different people. So what are your specific expectations for cleaning your room? As an example, maybe that's keep your clothes in the hamper, especially for teens. Keep your shoes together, vacuum the floor, make the bed, wash your clothes. That might be the expectation. Some people might expect dusting or whatever else they might expect. It's important that you and your teen are on the same page with what exactly you mean when you tell them to do something. And that goes to all realms of their life. That's with chores, that's with homework, that's with work, that's with managing their friendships, their social life, their usage of electronics, which is very important. They're teens and they get away. And I know for myself as a parent, I get sidetracked, and the phone can be helpful for keeping kids engaged when you have a whole lot to do. But it's still important to monitor those things and make sure that when they're using social media, that your expectations are very clear with them. Does that mean they're not going to break the expectations sometimes? They probably will, because that's what they do. Their decision-making skills are not intact yet. So we have to give them grace, and give yourself grace for being patient. But the expectations have to be clear and the consequences have to be clear. And in this phase, in terms of consequences, because you're dealing with a teenager, it's important to draw them into determining what consequences should be. They're old enough and gaining their independence enough that they're going to experience life consequences as we do as adults. So it's important to include them, to make sure that things are fair and everything is very clear about what you expect and what is going to happen should these expectations not be fulfilled. Communication. I have worked with numerous teens that I feel like we have a good strategy. We're talking about, my number one thing with teens when I work with them is, did you make sure that you try to talk to your parent at the right time? Don't come to your parent if they just got off of work, they're tired, they're already fussing about something. Let your parent be relaxed. Get them a cup of tea, maybe, make sure that they've had a good day. Do your check-in first. Check the temperature of the room before you go to engage your parent. The difficult thing and sometimes discouraging thing that happens with these sessions with children is the parent doesn't listen. I'm not confident that teen will take this information or take this communication strategy to the parent, and the parent will actually sit and listen and give teen an opportunity to effectively communicate. It's so important that we listen to our children, we make them feel comfortable, we let them feel like they can come to us with anything. Even if you have to cry when they leave the room, even if you have to scream into a pillow or call your best friend and tell them all about what happened, it's important to let them tell you what's happening and be open to listening. Teaching skills, assume nothing. If you want your child to wash their clothes, you have to teach that skill. Washing clothes, doing dishes, organizing themselves, managing their time, even completing big projects, knowing how to manage those things. Those are skills and they have to be taught. And we have to teach our children to the best of our abilities. Maybe it's an area where we struggle. Whatever it is that you know that works for you, those are things that you may teach to your child as well. And then just teaching by example. Be an example yourself. Communicate clearly. Show them what you do. I use a lot of Post-its. I use boards. I buy my children those things as well because I know they work for me. And just trying to take care of yourself and communicate the way that you expect to be communicated with. You don't want hostility. You can't come to your teenage child hostile. They're not small children anymore. They're becoming adults. They have sensitive feelings and they're overly sensitive to criticism. So we have to be mindful of that. So the importance of making sure that your children understand the importance of self-care themselves, not being too hard on themselves. One thing I have learned to do over the years is forgive myself. I may have a moment. I'm not suggesting I'm the perfect parent, and I don't have a moment where I'm yelling and fussing and everybody's disgruntled and I just have to pause. I give myself a lot of grace and a forgiveness and try to just do different in the future. But teaching your children also about just taking care of themselves physically, helping them establish workout routines, keeping themselves active, eating right, and sleeping. Sleeping is so important. Our teens are staying up on the computers. They're staying up trying to do work. They're trying to be on social media. So we really have to preach to them and help support them with, making sure they go to bed, turning out the lights, turning in phones if that's what needs to happen. But that sleeping and eating and staying active is important. Also emotional self-care, learning ways to de-stress, learning coping skills, learning how to communicate, just learning how to regulate themselves and how to create boundaries within their relationships, not being taken advantage of by their peers or even just learning how to self-advocate for themselves is very important. And then social self-care. So encouraging positive interactions with others. If you're seeing that your teens are in unhealthy relationships, and that can be with romantically or with their peers, that you help them learn how to navigate that in a positive way, and encourage them to join clubs and whatever suits them. If it's singing, if it's track, if it's whatever, encourage them, show up. Lend your support to them and make sure that they're involved in their community as much as possible. They're all ways to promote self-care. And then let's see here. Okay, I had to figure out my slide for a second. So learning how to deal with conflict with your team. Make sure that we're listening and validating. It's so important for them to feel like you heard them. I understand how you feel. It doesn't mean you're always going to agree. It doesn't mean that the conclusion is going to be what they want, but it just means that you are showing that at least you're willing to listen and you're willing to say, I know that this is frustrating you. I know that this makes you angry. And I understand that. One of the things I always think about to help me ground myself is that I was a teenager and I remember school being hard. I remember navigating my peers and figuring out what I wanted to do and having the courage to say no, standing up for people sometimes if I felt like I needed to do that, even having the courage to say to my parents if something they did was totally wrong. These things aren't easy to do. And so we have to encourage our kids by listening to them and telling them we understand how they feel. May not mean I'm going to give you what you want, but I understand how you feel. Give your teen space. Sometimes they're going to go to their room, that's their retreat, or wherever it is for them, whatever that space is. We have to respect that. Sometimes they just need to isolate. It's not personal. It's just something that they need to do. Then navigate and collaborate. When trying to find that balance of not overstepping when your teen has to work through something, let them work through it, and you're there to help them navigate the situation, not to take control or tell them what to do, because it is their life and they need to figure out how they're going to manage it. So giving them that space to just make a decision on their own. And lastly, teaching responsibility, chores. You can establish routines in your house and expectations charts if you like, or just have a verbal contract with your teenagers. But at this phase, they're big and strong enough that they can take on certain tasks, whatever you deem appropriate in your house. managing money. One time I shared in the beginning, or before we started recording, that I actually take care of my niece who I've adopted through kinship care. And there was the point where she had her own little money and she was like trying to make a charge on my card for like $400 for sneakers. I was like, whoa. I called her up. I'm like, what's this? And she's like, oh, I want to buy these sneakers. I had money. And I'm like, hun, let's think about this. If you spend it all now, there's not what's going to be left for the future. You may have things you want to pick up over the year. We had to explore. And since then, she's been much more responsible with her money, but we had to talk about budgeting and being responsible with funds. As we all know, prices are increasing and you have to hold on to the little money that you have. And then with decision making, as much as possible, you want to give your child independence and making decisions. Of course, we want to try to we present things. There's risk and reward to every decision that we make. And we know that as adults. And you have to help your children with learning how to navigate that as well, without overstepping. Of course, you want to share your viewpoint, but ultimately this is their life and they have to live it and they have to be able to make decisions that are going to work for them. So in conclusion, be patient with your child, be patient with yourself. Taking a step back, taking a break is very helpful. Sometimes you can take your car ride or call your friend, do what you have to do, but being patient and not reactive is teaching your child a skill. And also it just creates a better atmosphere. Stay involved, know what's going on as much as you can, invite them to communicate with you and share their life with you and just stay active and involved. Even if they try to push you away, you got to stay grounded and you have to stay in the know as much as possible and keep learning. Come to seminars like this, do your reading, do your Google searches, watch your YouTube and your TikTok, whatever is helpful for you, but be open to keep continuing to learn what your child needs. Our children are in a cocoon phase, right? They're like little caterpillars right now. And our job as parents is to let them develop, but be that branch that holds them very tight. And at the end of that, they will evolve. The idea is that they evolve into this beautiful being, this beautiful butterfly, but we have to give them that courage and strength, and we have to support them, but yet hold them tight as much as possible so that they can flourish and evolve into beautiful beings. Thank you for listening to my spiel. I think we're going to pause and take questions now.
Great. Thank you so much, Angie. I love the butterfly analogy. I'm going to stop recording now so we can go into questions.